It is National Infertility Awareness Week, and joining us now is Dr. Aida Shanti from Aurora Healthcare with more on infertility.
So talk to us about how you as a physician evaluate key fertility issues, and both men and women, because
Sure.
both do play a role here.
Yeah, thank you first for having me.
Of course.
The first thing that we do usually is we do a full evaluation for both the patient and her husband. So we do, for the patient, we do blood testing for ovarian function. We check also the thyroid. We check other hormones to make sure that there's not influencing the whole health of the patient. And then we do a testing to check the uterus and the tubes to make sure that the tubes are open and the uterus looks normal. There are no polyps, no adhesions, no fibroids. And then we do a semen analysis to check the husband to make sure that the count is normal, the motility is normal, and the shape of the sperm is normal.
Okay. And you know, a lot of myths surrounding infertility, fertility,
Sure.
what you should do, what you shouldn't do. What are some of the things that you recommend to your patients or people?
So the first thing is age. Age is a great issue for women, especially for women.
Right.
Men, I think, maybe after the age of 55, but for women, I think 35 and above, that's a crucial time for women. We know that for sure that the pregnancy rate drops after the age of 35, but drops dramatically after the age of 38. And miscarriage also increases. So I would really recommend for all women who are 35 and above not to wait more than 6 months, try on their own unprotected intercourse. But if they don't get pregnant, they really need to seek help from a fertility physician.
And what are some of the options for help? I mean, we're talking freezing eggs, we're talking in vitro.
Correct. So there are minimal invasive, like we usually, after we evaluate the couple, we decide whether they need minimally invasive treatment or high invasive treatment. So minimal invasive treatment like artificial insemination, where we take the sperm, wash it, prepare it, and put it inside the uterus with or without medication. And this medication could be oral medication like Clomid or Letrozole, or it could be injectables. And then, of course, we have in vitro fertilization, where we take the eggs, the sperm, fertilize them in the lab, create the embryo, and then put the embryo inside the uterus.
All good for people to know. Dr.
Yes.
Shanti, thanks so much for coming.
Thank you very much.